We have new data around the frequency of Medicare Advantage plans denying prior authorization requests. Each year, the Kaiser Family Foundation gathers all of the data around prior authorization requests submitted to Medicare Advantage plans within a given year. This usually is released 2 years back because of the availability of these numbers. So the 2023 numbers were just released this past week, and I think it will surprise many people. For context, in 2022, the total number of prior authorization requests was 46.2 million, and the denials as a percentage of all requests was 7.4%. That was up from 2021, where denials were 5.8%. In 2023, the total number of prior authorization requests went up to 49.8 million, and the denial percentage dropped to 6.4%. Let's break this down a bit to help us all understand the impact of these numbers. This video is not to try to persuade anyone to an Advantage plan or a supplement plan. I have a bunch of long videos that break down each plan type's pros and cons in more detail. This is not that video. Its sole purpose is to show you the most recent data out there around Advantage plan denials. This is most directly applicable to those of you already on an Advantage plan, not those of you who have a supplement plan and enjoy your supplement plan options. With that out of the way, if you are on a Medicare Advantage plan and you experience a denial, you and your doctor can and should appeal that denial. Most denials through the Medicare Advantage plan process are as a result of an administrative error, meaning incorrect coding of the procedures requested or not supplying necessary detail. This is on your provider's office side. So having the provider office correct the errors or provide the proper documentation and send it back, while it is annoying, will help. Of the 6.4% of denials, only 11.7% were appealed. This is up from 2022, where it was only about 9.9%, but still only about 1 in 10 denials are appealed. Why this matters is because of those that are appealed, 81.7% are overturned. So if you experience a denial, appeal it. This 6.4% number needs to be broken down a bit more to understand context. In the managed care world, there are reasons for a denial. Some are warranted, some are not. I already mentioned one, incorrect billing codes. The technologies that exist in the prior authorization space are archaic compared to what's available in the rest of the world. But historically, we have had providers and hospitals building their technologies and systems separately from the insurance companies building their own technologies and their own systems. And oftentimes these two do not update at the same pace, and there are communication issues resulting in problems for you, the patient, which is not good. There are changes coming to the Medicare landscape starting in 2026 to attempt to fix this in some way. But the point is, if the doctor is requesting that you go through procedure A, but does not have the imaging or the correct code, and it is submitted as some sort of a procedure B, that is a reason for a denial. This is way oversimplified, but that is a general idea of one of the denial reasons. Another valid reason for a denial in the context of managed care is when an individual seeks care at an out-of-network provider or facility. This is applicable to HMO Advantage plans or Health Maintenance Organization Advantage plans. They typically do not have any sort of out-of-network benefit, and why we talk constantly on this channel about how important it is for you to visit in-network providers if you go with an HMO Advantage plan. This is a very common reason for denials that make up part of that 6.4% number, and like it or not, it is a valid reason for an insurance company to deny a procedure. It is much, much less of an issue on original Medicare and a supplement plan because a supplement plan does not have a provider network. It follows original Medicare, and about 97% of providers nationally participate with Medicare. But if you are on an HMO Advantage plan, it is critical that you understand networks. To clarify something that is often misunderstood, if you are on an HMO Advantage plan and you have an emergency where you need to visit an out-of-network provider, emergency care is treated as in-network. I get this all the time where people are afraid that they won't have coverage while traveling and an emergency happens. You do have emergency coverage while traveling, both in the United States and internationally, with an Advantage plan. But as soon as that turns to non-emergency care, you don't on an HMO Advantage plan. Okay, another reason for denials is providers will, at times, submit claims to an insurance company that is not your insurance company. A common reason why this might happen is if you are visiting the provider that you've been with before, but you changed your Advantage plan between your last visit and now. If you had insurance company A the last time that you visited your provider, but you switched your Advantage plan to insurance company B over the annual enrollment period, and you didn't tell your provider, they might still be billing your old insurance company. And your old insurance company is going to deny that claim sent to them every time because you are no longer part of their plan. To avoid this, always update your providers when you change insurance companies and Advantage plans. There are other valid reasons for claim denials, but let's get to the one that everybody loves to hate, and that is the improper claim denial, the one where the insurance company has some evil motive and is auto-denying claims that should have and would have been approved if that person was on original Medicare and a supplement plan. Yes, it does happen. There are claims that are denied that would have been approved had the person been on original Medicare. I have made several videos on trying to get to the bottom of how many or the likelihood of this happening to you. The most sure answer that I can give you is that it is some number much less than the 6.4% number of total denials. That 6.4% number is made up of all of the reasons that we have discussed and more. Out-of-network denials, wrong insurance company denials, excluded services, non-medically necessary procedures. These happen on original Medicare as well. Other reasons, and what we're talking about right now, improper denials. Now, the Office of Inspector General did a study on this a few years back that came to the conclusion that 13% of the denials analyzed in this study likely would have been approved on original Medicare. There are problems with this study to where I don't know that I believe the numbers to be super accurate, meaning it could be lower and it could also be higher. But using that number, that means that in 2023, there was a 0.8% chance that you would be improperly denied care on an Advantage plan that you would have been approved on had you been on original Medicare. So less than 1% chance of improper denials. But 0.8% of 49.8 million is still a hefty number at 414,336 claims. So if you want to avoid this 0.8% chance of improper denials, or you just want to avoid the need to rely on provider networks set by an insurance company, or you want to avoid the need for prior authorizations in general for most procedures, and you can afford it, get a supplement plan. They are wonderful. If you cannot afford one, or you do not want one, hopefully this video helps you in some way understand the likelihood of denials. I leave a secret code word at the end of most of my videos to help me with comment management. If you leave the word wave, like an ocean wave or just a hand wave, then I'll know that you've watched this all the way to the end, you've seen the information outlined, and then I can take those comments a little bit more seriously. If you haven't subscribed already and want to stay in the loop of what's really happening in the Medicare and Social Security space using real data without the fear tactics, hit the subscribe button. Here's a video that goes into more detail about the other aspects of Advantage plans and supplement plans outside of just prior authorization denials. And then here is a video about some updates to the Medicare supplement plan laws in various parts of the country. I will see you in one of those.